Hello everyone, my name's Gary Morris. So I guess I'm really considered to be a clinical academic. So I work at university as a senior lecturer 3 days a week, and 2 days a week I'm a physiotherapist in NHS Wales. In that role I work with a range of people providing neuro rehab to adults with different neurological conditions. And in that role I've developed an award-winning spasticity management service. So I was one of the first physiotherapists in the world to be able to prescribe medicines, which I do clinically, and I provide ultrasound-guided injection of Botox for the management of spasticity. And this is a subject I've kind of taught on nationally and internationally. At the university, my teaching and research activities are kind of related to neuro rehab and this topic. And I guess that's one of the reasons why we've chosen to cover this topic, as I would imagine it's a symptom that many of you see regularly and that you're involved in. Now, when we cover this as part of the MSc, we spend a whole day on this topic as part of your neurorehabilitation module, which is one of the optional ones. And throughout the day, we'll talk about the pathology, its impact, how we might assess it, really dig into the evidence behind the physical management options, how medical options like Botox might interface with that. And importantly, we'll actually then work through some case studies together. And probably I'd say most importantly, what we do at the end of the day is then we'll get you into some small groups to do some group work where you'll be given a clinical scenario and asked to use the knowledge you gained throughout the day to develop a management plan for that person. And then we'll kind of discuss and analyse that. And that's I'll run that in the next kind of 15 to 20 minutes. So I'm just going to give you a couple of different snapshots of things that we might cover. So just as a reminder, spasticity is something we see with any damage to the upper motor neurons from your cerebral cortex here down to the spinal cord where it interfaces with your alpha motor neuron. So we're talking about conditions like stroke, traumatic brain injury, spinal cord injury, cerebral palsy, many conditions I'm sure you're very familiar with. And we're going to kind of focus in on here in a second. Here again, a couple of pictures of some of my patients with presentations you'd be familiar with. This gentleman here has had a stroke and spasticity in his upper limb. This gentleman here has MS affecting his legs. And we know spasticity is kind of characterized by this increase in muscle tone, affecting specific muscle groups in the body. And importantly, then we have this exaggerated response to stretch. Yeah? So we might try and stretch a muscle which has spasticity, and it can pull back against us. That's the physiology of what goes on. But just for today, I guess probably at a basic level, we can think of spasticity as having a neural and a non-neural component. So from my previous slide, we're going to zoom in on an area. So this is your spinal cord, and this is your alpha motor neuron. So this is the bit of our anatomy which tells our muscles what to do. Yeah, it provides with normal muscle tone and normal going to see. But particularly for us, there's also the non-neural or biomechanical component. Yeah? So here we're talking about the muscle tissue itself. And what we have here is under an electron microscope. This is a healthy muscle and a muscle which has been immobilized for a number of weeks. Okay? So we know when muscles don't move, they become stiff, they become shorter and become contracted. And you have a muscle which is stiff and contracted, then it becomes more sensitive to stretch. So that therefore makes the spasticity worse. So the neural and non-neural components get in this kind of vicious cycle where things deteriorate. And that's kind of what we're fighting against. Now spasticity, and it doesn't cause too much problem, but we know it causes a number of issues, particularly problems with function, pain and stiffness, involuntary movements and spasms, and of course risk of contracture and skin breakdown, which can be particularly risky for people. Now there are lots of guidelines around spasticity, and we kind of draw on those. We also need to go a bit deeper. We look at some of the primary research, so original research, investigating the effectiveness of some of the things that the algorithm for the national guidelines. And we will kind of go through this in some detail to help us understand the best ways to approach spasticity. And you can see here, physical treatments are towards the top. We should be considering these before we get involved with medicines and injections. And we'll explore these in some detail, but I'm going to focus on one element which I'm sure all of you do or have used at some point before, yeah? And that is stretching and splinting when it comes to spasticity. And when these things maybe use up a lot of time and resources, like stretching and splinting, it's important that we start to investigate how effective they are. okay, through robust research. So what I'm going to share with you now is some evidence around stretching and splinting. So this is a systematic review. If you're not familiar with systematic reviews, it's something that is covered in a lot of depth and detail as part of your research modules. But in short, it's where we take in a number of robust studies on a particular question and combine the results together. We looked at studies which investigated the impact of stretching and splinting on joint mobility in people with neural conditions. Okay? Risk of contracting is only one risk. Yeah? There are other issues with it as well. So what I'm going to do now, and bear with me, I'm going to talk to you a bit about paint. Right? Now, if you take a new tin of paint, you pop a stick in it, okay, and you start to stir it, it's very stiff. Okay? When you start doing it, it's very stiff, but as you continue to stir it, it becomes less stiff and easier to move. But you've not added anything to the paint to make it easier to move, okay, or to make it less stiff. So what's happened? Well, what happens in this case is something called thixotropy, okay, where when the paint is still and not moving, small cross bridges form at an anatomical level, which make it stiffer. But as soon as it maybe passive movements, stretching and splinting, I talk to patients about this, yeah, the fact that if we keep the joints moving every few hours, that can have significant benefits in terms of reducing their tone and increasing range. Used one, which I administer quite regularly, is botulinum toxin, better known as Botox. If you're not familiar with Botox, obviously it's something that we inject directly into a muscle with the aim of reducing the tone, which it does do, and it lasts for 3 to 4 months. There are some risks with it. There's a risk of up to about 1 in 100. It can cause swallowing problems, dysphagia, which can cause a risk of aspiration pneumonia, which particularly for some of our stroke survivors can be an issue, literally, okay, in the central nervous system. The way botulinum toxin or Botox works is at that neuromuscular junction. Okay? So the alpha motor neuron is sending down all these abnormal signals, increasing the tone, and when we inject the Botox, it actually stops acetylcholine release at the neuromuscular junction, reducing the tone. So that's the kind of the benefit we get from it. So let's have a little look at a case study. Let's take what we've learned there, okay? And stretching, which does help. So when he's done his passive stretching, it's a bit easier to dress his arm, but we've still got quite a significant proposition of the muscles. Ultrasound imaging. Now, I'm sure many of you may have seen or known of what Botox injections being done without any form of guidance, just done based on surface marking palpation. Okay. Now this, I recommend that practitioners utilise some form of ultrasound guidance. There are other options as well as X-ray and EMG, but certainly today this is becoming the gold standard. One of the reasons it's becoming gold standard compared to other localisation options is this. Okay? And then down here we have median nerve and an artery. Okay? And the distance between here and here is only a few millimeters. So there is, you've seen it. It can cause multiple problems, risk of contracture, problems with function, pain. But spasticity management does reduce symptoms and improves function in people with spasticity. Physical treatments are the most important element, and even though some of the evidence might not be as strong as we want to come and join us next year. If anyone has any questions on the topic, you feel free to ask me. And again, my contact details are available on the website. If anyone does want to drop me an email, we can discuss.
I think just to add, just to emphasise, and I hope it's coming across, we're here now with Gary. We can see that one, he's got an awful lot of expertise and an awful lot of experience, but equally he's very approachable and is always happy just stopping and discussing and sharing his sort of knowledge and expertise. And I think that's a real advantage of actually coming to Cardiff. I think overall, talking about the whole team, that is sort of our approach. It's very much about being able to discuss, ask questions and discuss these sort of issues sort of in the classroom, and to have access to people like Gary, with that expertise. I just wanted to sort of highlight that. I see there's a question that's come up about being able to interact with patients one-to-one in sort of Cardiff Uni, and we don't have clinical contact in that way as part of the programme. So it doesn't have sort of that clinical component to it of directly working with patients, but you are building the knowledge and skills to really strengthen how you work clinically. I don't know if there's anything you'd add to that, Gary, thinking about the neuro rehab module.
Well, I have to say that, I did my master's degree some time ago now, but it really propelled me forward in terms of my practice, in questioning what I do and being able to justify what I do and be able to use evidence to really influence what I'm doing. And also, having an MSc has really helped me to move forward in terms of career progression. I would not be able to be doing the things I'm doing now without having that master's degree. There's a minimum requirement for a number of things that I'm involved with. I got my master's degree here at Cardiff. That's where I did my first degree. But I do love the institution, and I feel like I owe it a lot. And I'm glad to be, in combination with my NHS role, to be able to kind of support, the education of students both domestically and internationally. I think it is great to have you guys here and for us to share, practice across the globe, really. So I'd be very sure to see.
I have for everyone, all the students, and we just want to understand a little bit about your future aspirations, and if you'd be interested in another taster lecture in the future, just say yes, or if you think you don't, you can say no.
Yeah, I know people. We have done this in the past, and people who like to get an idea of like who we are and what a session might be like. And I'm sure it's not overly different to what you might expect. Sometimes hopefully it's nice to see. Okay, you get an idea of what it might be. And I'm sure, I guess, one thing I probably add is, in addition to sort of just you sitting and listening to us talk, all our lectures are recorded, to be able to watch back, and we do supplement them with videos as well. So, for example, I have some videos up of me assessing and treat and injecting some patients alongside an instructional video on how we go about assessing tone through certain methods. So there's lots of supplementary materials as well as the face-to-face content on our virtual learning environment.
I think hopefully you'd agree with me, Gary, but it struck me when the question came in earlier about like the rude approach, and you sort of said, well, we'll look at rude and we'll bow bath and other types of approaches. And actually, and particularly for practice within the UK, it is understanding the research evidence that underpins your practice that actually then has the big impact on what you choose to do and how you work with patients. And I think actually taking some time to understand that research and that evidence base is really important, and the MSc gives people the chance to do that and to question practice. Would you agree with that, Gary?
Absolutely, because obviously I work with a number of leaders, or people who are the employers, and they say, look, when people come to the Masters, they come with a different mindset. They are prepared to question practice, not just to do because that's what I did when I trained, and I just do it because that's what I do. They're prepared to question their practice and question how they might evolve things in the future, which I think they really value the different level of thinking that comes with someone who's completed a post-registration master's degree.
I sort of said no because it's not part of the programme as the programme sits. But when I was in India recently, we heard really loud and clear how getting practical experience would be really helpful. So we have a number of initiatives, but one that I can sort of mention to you guys now, because I was in a meeting only yesterday and we agreed to take it forward, is we've done a lot of work with Welsh Touch Rugby, one of the sports teams, over the years. And what we're looking to do is to run just monthly teach and treat clinics. So you'd be working alongside people who volunteer, so it's on top of your programme. We'd be working alongside some of our expert sports physios when they're seeing some of these patients, and also getting an opportunity to support some of the big events that they support. So, for example, Cardiff Half Marathon, we always have a sports massage team. It's, historically, the pre-registration students have been involved, and some of our alumni have always come back to help and support. And now we're sort of opening up these opportunities so that you guys do get that chance to get sort of more involved in some of the activities that we can do. So I can talk about that. We've got other things we're hoping to develop, but we know that's going to be starting from October. So, for the guys, if you're thinking about coming September or next January, we know that we'll have some of those events in place by the time that you come. So there will be some opportunities. but they'll be sitting sort of over and above your studies, not an integral part of you. Yeah, brilliant. If you're coming in for the January cohort, in your first semester, you'll do a research module. So that research module is really going to help you question and critique the evidence in the literature. It helps you start to understand research and build up a research proposal. Alongside that, you've got a choice of optional modules. So there's neuro rehab, and you've heard Gary talk this afternoon, or morning, I should say, for you guys. We've then got, oh, thanks, dear Oz, good thinking. You've then got the musculoskeletal diagnosis and treatment module, which really is looking at musculoskeletal physiotherapy. We've got the cardio and respiratory care module that's got that specialty within CBR. And they sort of sit in that first, so it's one optional module, one compulsory module each semester. Following that is your dissertation. So that's 6 months after that is your dissertation.
Any more questions? Thank you, Graham. Any more questions, guys?
See the polls popped up again.
It has. Where did that come from? But Graham, seriously, thank you. Thank you for spending the time here.
It's been great to have a chance to meet you guys and to have your questions, definitely. And really interesting to, get to talk to you guys and
Yes,
ask questions.
Yeah, I will, as a counsellor, I will urge to do more and more research about this university. As I'm repeating here, it's world rank 186, and when it comes to Russell Group universities, that means it's world rank. In UK, it's called Russell Group. In US, we call Ivy League. It's the same like in UK, it's Russell Group. So it's a world rank university, world rank 186. And as I mentioned, 1.5 year makes a lot of difference, adds a lot of value compared to 1 year. And yes, 1 year is equally acceptable across the world, including India. But 1.5 year gives you more exposure, time to study more. That is, having said that, Cardiff is less expensive, unlike London. So you save a lot of money while doing your part-time as well, or at least you don't have to stretch a lot to do your part-time while studying and concentrate on studies. So all these aspects are equally there. So my suggestion, and I keep telling each and every student that at least let's apply. Because A, when you have offer letters in your hand, that's when we can again have these sessions with such experts to give you even more insights, because you want to join that particular university, that is Cardiff. And they have January 2026, September 2026 as intakes. Let's apply, free application. Our services are free. They are just email away, and they're again happy to assist us based on our prior request to them. 1.5 year course and plus 2 years of stay back visa. Again, ILR has also not been changed. It is still 5 years, so not to worry about that. We've also got to know about salary benchmark or salary numbers today, which is matching to the UK government threshold. So that is again not a worry here, because again, as I mentioned, Russell Group University adds a lot of value on your CV, and ये आपके साथ जिंदगी भर रहेगा. So that is going to be in your on your CV throughout your life, that you pass out from Russell Group University. And as I mentioned, if you wish to connect with my ex-students, those who are passed out, those who are currently working with sponsorship, I can give you their names. You can connect with them on LinkedIn. This is exactly what about Cardiff, and I urge you to apply well on time, get their scholarship, have their offer letters, and then again take your 4 to 6 months to think about it for September intake. We are not rushing you. We are not asking you to rush. Just apply, have offer in your hand. That gives a lot of confidence and clarity for parents as well.
And really looking forward to having more sessions like these.
Correct. Absolutely. Yes.
Thank you.
Thank you.
Thank you, Graham.